You know the phrase, behind every great man stands a great woman. Well, behind
Right.
every ventilator stands a great respiratory therapist.
Scott, thank you so much for being here today. I really appreciate you making time to talk to us and to enlighten us. And also, we want to show our appreciation for everything that you do. I mean, I can't wait to learn about your role at the hospital as a respiratory therapist. So, thank you so much for being here today.
Oh, thank you for having me here. And thank you
Of
for allowing us to speak out.
Yeah, of course. I can't wait. So, obviously, right now we're going through this pandemic and we're learning so much about the healthcare system. Can you explain to us what you do? What is a respiratory therapist?
So, respiratory therapists treat and manage any patient with acute or chronic lung disease. So, people
Oh,
with asthma, COPD, pneumonia, the coronavirus coming out. In essence, we are the lung experts. We all went to school to
wow.
become the lung experts. We're hearing the word ventilator a lot on the
Correct.
news, and you know the phrase, behind every great man stands a great woman. Well, behind
Right.
every ventilator stands a great respiratory therapist.
Wow. And you know what? I just saw an article the other day about unsung heroes for respiratory therapists because you guys are on the front lines dealing with COVID-19. So, how has that impacted you?
It's been kind of scary. We are, like you said, we are frontline workers. We are the ones who are there putting the breathing tubes in, managing the
Ooh.
ventilator. Um, and it's been really scary having to deal with something that's so unknown and being on the front lines and being really at high risk for exposure.
How are you protecting yourself? Has the routine for you changed? How does this look like?
So for us, the routine has definitely changed, as with everyone in the hospital. We are required to have our temperatures taken before we come in, and they give us
Mhm.
masks to wear all day. Everyone has to wear a surgical mask. And when we perform these very high risk procedures, we have to take extra precaution on protecting ourselves, because it's not just protecting ourselves, but it's protecting other patients and our families.
How do you mentally prepare for each day? Is there something that you do? Do you meditate in the morning? How do you gear up for this? Because, I mean, we're not even in the position you are, and it's mentally exhausting.
It's difficult every morning to prepare yourself to come in and just being ready to deal with the unknown. We don't know how many patients we're going to get in a day. We don't
Wow.
know how many patients we're going to have to hook up to a ventilator. We don't know how many patients are going to pass away from it. And so we go in with the same mentality, I think, a bit more strained, but the same mentality that we've always approached going into the hospital, is that we're here like everyone else to help patients, to save as many lives as we can, and to do the best that we can. So that is generally how, at least for me, that's how I prepare every day. Just go in and I promise myself, do the best that I can, save as many lives as I can. And if I can do that, then I would have had a successful day.
We are hearing in the news, that there's not enough protective equipment. How have you been able to deal with this? Hopefully, you guys have been able to have enough. I'm not really sure how that looks like. And how can we all help?
It's been I think, just like in the news, you hear that every hospital is definitely
Sure.
doing their best to try and conserve, but also try at the same time protect the healthcare workers. Because as you had said before, um, we're not quite sure where we are in the whole mix of the coronavirus spreading.
Right.
And so we do have the protective equipment that we need. We are very mindful of how often we use it.
Right.
And as respiratory therapists, we are also very acutely aware of the best situation to when to use the specific
Wow.
type of equipment. And for the general public, I think the way that everyone can help is, to maintain the infection control policies, social
Right.
distancing, washing your hands frequently, disinfecting surfaces. And if anyone out there has surgical masks or N95 respirators that you can donate to your local facility, that will always help. that will make the public seem like heroes to us, because you are doing your part to help protect us.
Well, you guys are such heroes. I literally don't have enough words to thank you and everything that you do. So just so you know, you guys are truly the heroes. And Scott, before you get out of here, because I know you have so many other things to do, what are you most hopeful about, most optimistic about? Anything you're looking forward to?
Um, I I'm looking forward to actually seeing toilet paper on the shelves again. Um, I think that would be great. But honestly, the thing I'm most hopeful for at the end is that we learn something from this, both in acknowledging all the frontline workers, because it's not just the
Yes.
frontline workers in the hospital, it's the grocery store clerks, it's
Right.
the mailmen, it's the food delivery people, the restaurants who are choosing to stay open. And I'm hopeful that, this self-quarantine has really taught us the importance of staying in contact, physical contact with one another. Because when you're at the bedside, a lot of these patients, sometimes the best therapy is just to hold their hand, and it makes them feel so much better. And my hope is that once it's all over, that people will really appreciate the beauty of meeting each other face to face and enjoying each other's company.
Absolutely. Scott, we appreciate you so much. From the bottom of my heart, thank you for everything that you do. We're here, and if there's ever anything that you need us to do, but we're going to spread the word, make sure you're washing your hands, and if you have extra masks, go deliver it at your local hospital, facility,
Thank
and
you.
whatever we can do, you just let us know, and we're here for you.
Thank you. Thank you
Of
so
course.
much.
Thanks, Scott.
All right. Thanks, Nessa.
Of course. Okay, so if you enjoyed this video, show it some love by liking it, commenting, and subscribing so that you never miss out on the latest celebrity interview.